I'm Ana Diallo. I am a tenure-track assistant professor at VCU School of Nursing in the Department of Family and Community Health. Nursing research is all about inquiry and curiosity. In my own words, it also means digging deeper into phenomena that are not really examined at the bedside. I am interested in looking at the interaction between diet and other socioeconomic factors that influences dietary behavior on cardiovascular risk factors, primarily elevated cholesterol, on minority populations, and so primarily Black Americans. And what really sparked my interest in that research field is personal experience. Growing up and losing close relatives really early because they had elevated cholesterol that was for some part genetics and other parts the environment. Having limited access to healthy food, healthy stores selling healthy food, and also not being understood by their primary care providers, where they just gave up because they felt that the system gave up on them. And so that's what drove me to leaving my postdoc at the NIH, where I was at the bench, and really coming to an environment, a university that was fostering community engaged research, because that's where I knew I belonged to. It's being able to build this collaboration with members of the communities that are facing those challenges, and then asking those questions. Unfortunately, the consequences of elevated cholesterol is felt when it's a little too late. You have a stroke, you have a heart attack. So having these conversations really piqued my interest on first the genetic aspect of it. And I heard and I knew a little bit about genetics from my previous postdoctoral experience, where we were looking at genetics and microbiome, but I never had the interest in digging deeper and seeing how both the dietary behavior and those socioeconomic factors that we also can call social determinants of health interact with how the genetic material that you were born with, so you inherited, to lead to a disease or a health condition that might lead to a cardiovascular event. I'm part of a team that is first building that relationship with the community. So we first want to understand what they eat, how can we help with facilitating access to healthy food. So that's through the prescription produce program. So through that experience, I'm building a collaboration, the trust with the community. And my role in the prescription produce program right now, because of other responsibilities, primarily leading the data collection and management part, ensuring that what we are doing is captured in a way that we can prove that it's working.